Well, good morning, everyone. My name is Byron Louis, Chief of the Okanagan Band, and I have a message that is being asked to be provided from Chief and Council to members. And this is the recent outbreaks in the Okanagan, and this, in particular what happened in Kelowna about 2 to 3 weeks back, and the consequences of that, those small gatherings, and then the participants in those gatherings had carried COVID-19 back to their home communities. That was lately as 80 people being affected by this action. And it's tempting to go back into our old ways of how we gathered and all the social events and whatnot. But the problem of that is COVID is still a problem. It is still active. It is still with us. So, we as Syilx people, we need to really come to an understanding of, and especially of our history that spans 500 years with pandemics and the destruction of these pandemics. And when we take into consideration that in 1861, there's 300,000 Aboriginal people in this province. And today we're just getting back to 170, I think it's 174,000. So you look at that, and we're trying to catch up to gains that were lost back in the 1800s. So when we look at that, it's not, we can't underestimate the seriousness of pandemics and how we respond to these. So it's important we continue to think and act in the needs, act in the needs of our friends, our family, and our community as a whole. And we ask people to continue on, following the advice, stay home if you're sick, wash your hands regularly. I think it's for over at least 20 to 30 seconds. Stay 2 meters or 6 feet apart whenever we're gathering, especially with people that we don't usually interact with. Keep your group small. That's under a number, but also keep in mind social distancing is so important in those gatherings. Avoid crowded areas, particularly indoors, and consider wearing a mask. And stay connected and stay apart. Please continue to heed the advice of healthcare professionals. By practicing the routines, we can reduce the impact of the pandemic on our community. And please, let's be kind to one another and respect each other's health decisions, and follow us on Facebook and Twitter, and visit OKIB website for updates. Thank you.